The United States Medical Licensing Examination, or USMLE, is a three-step examination for medical licensure in the United States and is sponsored by the Federation of State Medical Boards and the National Board of Medical Examiners. The USMLE assesses a physician's ability to apply knowledge, concepts, and principles, and to demonstrate fundamental patient-centered skills that are important in health and disease and that constitute the basis of safe and effective patient care. The clinical skills, or CS component of Step 2, is intended to assess whether an individual can demonstrate fundamental clinical skills essential to safe and effective patient care under supervision. These clinical skills include taking a relevant medical history, performing an appropriate physical examination, communicating effectively with the patient, clearly and accurately documenting the findings and diagnostic hypotheses from the clinical encounter, and ordering appropriate initial diagnostic studies. The purpose of this video is to acquaint qualified Step 2 CS examinees with the purpose, design, format, and logistics of this examination, as well as to demonstrate sample patient encounters. The clinical cases used in Step 2 CS are created by committees of academic and practicing physicians. Each Step 2 Clinical Skills Testing Center simulates a large medical clinic. It has 24 fully equipped examination rooms. In the course of the examination, you will go through 11 to 12 different exam rooms, and you will encounter a different case in each room. The only equipment you are permitted to bring is your own stethoscope and white lab coat. Please bring your scheduling permit and an unexpired, government-issued form of identification, such as a current driver's license or passport. We will provide a light meal during the first break, although you may bring your own food to eat during the breaks. Your Step 2 CS exam will begin with an on-site orientation session, where you will have the opportunity to ask questions and to clarify your sense of how the exam will work. The orientation session will also include a demonstration of the diagnostic equipment available to you in the examination rooms. You will be permitted 15 minutes for each patient encounter. The clock starts with the announcement to begin the patient encounter.
Examinees, you may begin your first patient encounter.
During this time, you're expected to read the examinee instruction sheet, take the patient's medical history, and conduct a physical examination. Immediately after each patient encounter, you will have 10 minutes to complete a patient note for that encounter. You will be able to write the patient note by hand or type it on a computer screen. You may have a case involving a child or an elderly patient in which your interaction is with the caregiver. In these cases, data gathering will not involve direct physical examination. For these and other cases, you may be asked to conduct the encounter via telephone. These cases, like all others, will provide relevant information and instructions as you begin, and will require that you complete a patient note after the encounter. As with other cases, you will be given 15 minutes for the encounter with the caregiver and 10 minutes to record the patient note. Cases presented in the exam represent a set of common clinical problems that generalist physicians encounter on a daily basis. These cases are carefully selected by expert committees.
Examinees, you may begin your first patient encounter.
At the start of each patient encounter, you will read an examinee instruction sheet posted on the examination room door. The examinee instruction sheet contains the opening scenario, with the patient's age and complaint, the patient's vital signs, and the examinee's tasks. In most cases, the task will be to take a focused history and physical examination and discuss your differential diagnosis and diagnostic workup plan. The tasks are occasionally different, so do read them carefully. Information on the examinee instruction sheet should be accepted as accurate. You may repeat the vital signs yourself if you feel the case warrants the physician confirming them, but consider the vital signs listed on the examinee instruction sheet as the actual vital signs of the patient when you develop your differential diagnoses and workup plan. A second copy of the examinee instruction sheet is located inside the examination room. Knock on the examination room door, Enter and introduce yourself to the standardized patient, just as you would to a real patient.
What seems to be the problem today?
Begin to take the medical history. Speak to the patients and examine them just as you would any real patient, but do not perform rectal, internal pelvic, genitourinary, female breast, or corneal reflex examinations. Instead, these examinations may be requested on the diagnostic workup section of your patient note, if appropriate. These encounters will simulate the kind of interaction one would expect between physician and patient in a U.S. medical setting. The patients will expect you to relate to them in a respectful manner at all times. During the physical exam, look for physical findings as you would with a real patient. More than one diagnosis is possible in most cases. We will announce when 5 minutes remain so that you can budget your remaining time.
There are 5 minutes remaining in this patient encounter.
When you are through with the history and physical examination, let the standardized patient know what diagnoses you are considering and what diagnostic tests you are planning to order.
I'm not exactly sure what's going on, but we had to do a couple of tests to figure this out.
An announcement will alert you that the encounter has ended.
This patient encounter is now over. You must now leave the room.
At that point, please finish your sentence and leave the room. You may leave before the full 15 minutes, but you may not go back into the room, so please be sure you have all the information you need before leaving the room. If by any chance you left something in the room, just speak to the proctors. They will be happy to get it for you. Please do not go back into the examination room yourself. Once you've completed the patient encounter, you will then complete what we call the patient note. This is the medical record of the encounter. You have the option of either typing or writing the patient note at the desk immediately outside of the examination room. The examining instruction sheet will be available to you should you need to refer to it while completing your patient note. You will have 10 minutes to write each note, and we will announce when 2 minutes remain so that you can budget your time.
You have 2 minutes to complete your patient note.
When the announcement is made that the time for completing the patient note has ended, please stop immediately. During the day, there will be 2 breaks for refreshments and other personal needs. Discussion of the cases or the exam is of course not permitted during or after the examination. All patient encounters are monitored. There are video cameras and microphones in each examination room. You will now see portions of typical encounters between clinical skills examinees and standardized patients.
Hello.
Hi.
I'm Dr. Tucker.
Hi, nice to meet you.
And what is your name?
Carolyn Dohack.
Miss Dohack, I hear that you've been experiencing some headaches.
Oh, they're just terrible.
How long have you been experiencing them for?
For about the past month now.
Okay. Can you describe the headaches to me?
It's just this terrible throbbing that's all over my head.
Any other symptoms that come along with the headaches?
Well, I have been feeling sick to my stomach.
How about any problems with vision? Have you been experiencing any of that?
Well, actually, right before I get the headaches, I see these flashing lights.
And have you ever had any of these headaches before?
Nothing like this, nothing this bad.
Okay. Okay, what I'm going to do is a brief physical exam. What we're going to do is we're going to schedule you for some more tests, and then we'll go from there. Okay?
Thanks so much.
Thank you very much.
Hello, Mrs. Bingham. I'm Dr. Kapoor. What brings you here today?
It's my throat. It's killing me.
Okay, and how long has this been going on?
I woke up with a sore throat yesterday.
And any other symptoms?
Well, I felt a little warm, but I haven't taken my temperature.
Any coughing or sneezing? And are there any diseases?
Each case is unique and reflects common or important medical problems. Cases that appear similar may be testing different things.
Okay, Mrs. Bingham, what we're going to do is we're going to take a throat culture, and we'll contact you.
At 15 minutes, an announcement will alert you that the encounter has ended.
This patient encounter is now over.
At that point, please finish your sentence and leave the room. Being prepared is essential for performance in the Step 2 CS exam, and we hope this video presentation will help you to be more prepared. For complete information about the examination, please consult the appropriate websites. The Step 2 Clinical Skills Test is a high-stakes examination. Security and fairness are very important. Any attempts to gain information on exam scenarios or to share information on completed examinations are strictly prohibited. In fact, any cheating or disclosure of test materials may lead to permanent exclusion from the examination system.